Hey, Riddle here, and I have a doozy of a video for you today. Now, I'm going to do the best I can because my brain is really foggy and I pushed myself a little too hard this weekend. But if you have been following my chronic fatigue videos and my general health videos, you know that I've been struggling with chronic fatigue and other strange, unexplained symptoms. And heavy, last year in 2020 in July, basically my nervous system completely freaked out. And I wound up 2 days in horrific pain at the urgent care, and followed by 3 days in a row at the emergency room here in Santa Cruz, California. Now, we've lived here in Santa Cruz, California, obviously in the mountains, for 5 going on 6 years. And when you live here, you spend a lot of time outside, especially if you're a hiker, wild mushroom hunter, or a gardener. So these last couple months, I started developing excruciating joint pain, swelling in my joints, along with the fatigue. And this, although I was achy all the time, I thought it was just old age or something. And even though I'm at a good weight and I take care of myself, it just, sometimes happens. And I know we have arthritis and other things in our family, including a lot of other crazy immune issues, immune diseases like scleroderma. I had an aunt die from scleroderma, hope I'm pronouncing that correctly, fibromyalgia, lupus, on and on and on. So I have been going to doctors nonstop the last 5 years. And I'm not talking about just general practitioners. I'm talking about, I've been going to the supposed Cadillac of healthcare, meaning the chronic fatigue clinic at Stanford, infectious disease doctors at Stanford, and then balancing that off into our other local doctors at PAMF and at the other hospital, which I can't recall the name right now, but it'll come to me. Dominican. And I have had so many x-rays, so much blood work done, and been just shuffled around consistently now for 5 years, but really shuffled around for 3 years. And last week, my spouse was at the beach playing volleyball with a young lady, and she was telling my spouse that she had gotten Lyme disease. So I reach out to the person who should have checked this. Number one, it should have been a no-brainer. And so I checked with my doctor at Stanford, and I said, did you do these Lyme disease tests? And I think she may have done a slight one, but I don't think she did them at all. So I requested that she did the full Lyme disease test. And at the same time, my GP, who refused to help me out with the pain or anything. I couldn't even sleep at night because the pain was so bad in my joints. And because of the drug addicts, they won't prescribe you any kind of pain pills or help anymore, even if you don't have a drug seeking history or a drug addiction history. She was pretty worthless, and she recommended me to a rheumatologist. You see all these specialists and the system they have. And excuse me if I sound bitter or cynical, but it's going to make sense in a minute here. So I go the day that I'm supposed to go to the rheumatologist. That evening at 1 a.m, the test result comes through for the Lyme disease, and sure enough, positive. Now, it was the minor one, not the second one they give you, the deep dive, the Western blot. I didn't realize that she had asked for the full spectrum of tests on the Lyme disease. So I go to the rheumatologist, lovely woman, and she said, well, this could be a false positive, and Lyme disease is more prevalent on the East Coast, and I want to run all these x-rays and redo the tests and blah, 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 blah. In the meantime, when I go to do the actual tests at Quest, the phlebotomist tells me that her husband, who is a logger in the area, had Lyme disease and suffered with it for a little bit over a year before he got treatment. The receptionist at this actual doctor's office, her mother has Lyme disease, has got it many, many years ago. Both of my neighbors have had Lyme disease. You see what I'm getting at here? If Lyme disease is so prevalent in Santa Cruz or in Northern California, why didn't anyone think of this? Why am I having to self-diagnose? And when I'm in such a poor state of health, having to fight so hard to do other people's jobs when it seems so obvious that this should have been one of the first things they checked. It's really ridiculous, and I'm really angry about it. So, it looks like I have Lyme disease, and now I have to coordinate all these assholes to figure out who is going to give me the antibiotic treatment and kind of make sure they give me the best one. Because I'm telling you, the doctors, I don't know. I know they're overworked. I know that they're caught in this weird system where a template is plastered on them, and they basically, like, every one of these doctors knew. I told them, I forced my lifestyle upon them. I let them know about, how much time I spend outside, where I live, everything. And you would think, if they had any experience whatsoever, that Lyme disease would have been one of the first things they checked. And the reason I'm sharing this with you isn't just to bitch and get it all off my chest, but I'm sharing it with you is because if you have chronic fatigue, if you've been experiencing arthritic pain, if you've been experiencing brain fog, and you have spent time in the woods. Now, I've had ticks on me many times. I never developed the ring. And I want to let you know, you don't always develop the ring. So don't let that be your reason for not getting tested for Lyme disease. If you have any of those symptoms and you've spent time hiking or you live in an area that has ticks, go and get the test. Maybe get it twice, because the Lyme disease may be the magic key to your recovery. And I'm still in the gray zone to know if the Lyme disease bacteria has been in my body for too long, if I will make a partial recovery or a full recovery. Because the Lyme disease bacteria, from what I understand, is very similar to the HIV virus, where the bacteria can hide in the body in places that the antibiotics can't reach to destroy it. And the treatment that I'm seeking is a intravenous antibiotics, and they give this to you for something like 18 to 28 days. And it's really hard on the body. It destroys everything good and everything bad. So you have to go and make sure you're taking your probiotics to replace everything that the antibiotics are killing. But at least I feel it's so funny to feel so much joy to know I have Lyme disease, because if you've suffered from any kind of deteriorating, mysterious, chronic condition, when you finally know that there is something, an actual diagnosis, there's so much relief in that. So I will keep you posted on my progress and my journey through this Lyme disease thing. I just wanted to take the time to share this news with you. And especially if you live on the West Coast, in central, the Central Coast or Northern California, that the first thing you should probably check if you're having these types of symptoms like I described to you is Lyme disease, because it is far more prevalent here than the medical establishment understands. The symptoms again, fatigue. Actually, when I wound up in the emergency room, I had fevers. I had muscle cramping pain. I had, which culminated into facial paralysis. Like, it got so bad that I literally had Bell's palsy. And the Bell's palsy, this is the interesting thing, the Bell's palsy cleared up in a very short amount of time, unlike most people with a different type of Bell's palsy. This should have been a huge rainbow red flag for the physicians, if there was any kind of follow-up care. But those bastards at the emergency room, they have these doctors or these specialists who come in. They don't even look at you. Sometimes they just look at your chart and they're like, blah, blah. And then they charge you in addition to the emergency room visit. And then the next day, when you're like, what the hell is this? And you try to contact them, you can't even find them. You can't even get any information, though they've already billed you. I mean, the American healthcare system is such shit. It is shit. A shit show on a shit show. Because if they would have taken some time to understand my lifestyle and all these symptoms, they should have tested me. They should have sent me to somebody. There should have been some follow-up care, or one of these many physicians. I'm seeing 3-4 different physicians, and nobody ever recommended or thought of getting a Lyme disease test, including the chronic fatigue clinic at Stanford. It's insane. And I'm very angry that I've had to suffer this long, and I'm not a doctor, but once again, I've self-diagnosed, and hopefully this is going to lead me onto a road to recovery. But it's hard not to be bitter when I think of the years, months, hours that I've lost in my life or had to push through suffering in exhaustion or pain. Okay, so that's it. Take care of yourselves. Take care of each other. I believe how we treat each other on the streets is our ultimate reality. And if you're feeling any of the things that I've described to you, don't be too proud. Demand a Lyme disease test. Bye.